With recent advancements in medical technologies, it has become more and more possible for those of us with impaired vision to get rid of our glasses or contact lenses by way of surgical procedure. My name is Joshua D'Entremont, and as a recent refractive surgery recipient, I've done a fair amount of research on which type of procedure would best fit my lifestyle. Today I would like to discuss the two most popular types of refractive surgery, PRK and LASIK, the benefits of each, and why it is most beneficial for those hoping to continue participating in more extreme sports to choose PRK over LASIK. So let's take a look at the types of procedures one can choose. Though there are many types of refractive surgery procedures, for brevity, we will focus on our discussion on the two most common. Laser-assisted in pseudokeratomeliosis, or for simplicity, LASIK, and photorefractive keratectomy, or PRK. Both procedures use essentially the same laser to reposition the focal point within one's eyeball and sharpen the image that is transmitted to the optic nerve. The difference, however, falls in how the cornea is treated before the actual laser procedure. In a LASIK procedure, a blade or a laser is used to cut a very thin layer of the cornea and flap it back in order to allow access and perform the laser procedure. The flap is then laid back into position after the laser procedure is performed. This type of procedure has its benefits. The first benefit, of course, is that it is virtually pain-free. The eye is numb during the procedure, and the healing process is begun before the anesthetic wears off. Second, the results are almost instantaneous. As the flap is laid back, you are once again looking through your own clear cornea. PRK, on the other hand, uses a buffer to remove the top layer of the cornea and allow access for this laser procedure. The procedure is a little more uncomfortable and can take up to a month before optimal results are seen, though some immediate results are seen. This is primarily because the cornea remains rough for several weeks before healing is complete. However, the fact that there is no flap allows more even and permanent healing. With a LASIK procedure, the flap heals from the inside out and has a propensity to pop open for up to 2 or 3 years when one is put into situations that may involve high pressure, high winds, or risk of moderate eye trauma. These situations include, but are not limited to, activities such as skydiving, downhill skiing, or martial arts training. For this reason, the U.S. military prefers to have its members who are assigned to special operations units as well as flying units receive PRK rather than LASIK. Though very few of us are put into these types of situations that special ops soldiers and pilots are every day, who among us doesn't like to play a game of football or go skiing whenever we get a chance. The fact that PRK forces one's eyeball to form an entirely new layer over the cornea means that the eye remains more stable and structurally sound during these high-impact situations. This also means that the results are more likely to last. According to the Laser Eye Institute of Utah, those who receive PRK are far less likely to have a vision lapse than those who have LASIK. To me, it was well worth a little more discomfort in the beginning than risking having to have the entire procedure done again a few years down the road. So today we have covered the two most common types of refractive surgery, LASIK and PRK. We've covered what they mean, what their benefits are, and their shortcomings. And I think it is clear to see that PRK comes out on top for those of us wishing to continue an active lifestyle. Thank you.